Today, we're going to be medical detectives. We're cracking open a case about a joint that gives us this incredible freedom, the shoulder, and what happens when its perfect, elegant design just catastrophically fails. We're going to look at how a pretty common injury can spiral into this debilitating condition and then uncover the brilliant, totally counterintuitive solution that changed absolutely everything for patients. So, let's start with how this marvel of engineering is supposed to work in the first place.
All right, here's our game plan. First, we'll look at the healthy shoulder's amazing design before we dive into how it all goes wrong. Then we'll see how doctors figure out the damage, check out the early fixes, and wrap up with the surgical breakthrough that literally turned the whole problem upside down. So first up, let's just take a second to appreciate the healthy shoulder. I mean, it is an incredible piece of natural engineering, right? It's designed for this massive range of motion. But here's the catch. All that freedom comes at a price. It relies on a really precise and delicate balance of forces just to stay stable.
Okay, now check this out, because this is how the whole system works. You've got the deltoid, that big muscle on the outside of your shoulder. That's your powerhouse, right? It gives you the raw strength to lift your arm. But if that was the only thing working, it would just jam the ball of the joint right up into the roof of the socket. And that's where the rotator cuff comes in. It acts like this perfect set of guide wires, pulling down and in, keeping that ball perfectly centered. It's a principle called concavity compression, and it's what lets your shoulder move so smoothly.
It is a beautifully balanced system, but that just leads to the one crucial question that this whole story is built on. What happens when those critical guide wires snap?
And that brings us to the villain of our story. When you get a massive rotator cuff tear and it's left untreated, the shoulder's mechanics are just thrown into complete chaos. And that leads to a condition called rotator cuff arthropathy. Dr. Charles Neer first described this way back in 1977. And rotator cuff arthropathy, or RCA for short, isn't just a tear and it isn't just arthritis. No, it's this really destructive combination of both. Basically, the rotator cuff isn't doing its job anymore, and that leads to all sorts of instability and a cascade of really severe degenerative changes inside the joint.
Now you might think everyone with a big tear gets this, but it's actually not the case. It's estimated that only about 4% of people with these massive cuff tears will go on to develop full-blown RCA. It's a pretty serious progression of the disease, where the mechanical failure leads to the joint essentially just destroying itself from the inside out.
And this image, wow, this shows you the problem perfectly. On this X-ray, you can see exactly what happens when that downward pull from the rotator cuff is gone. The super powerful deltoid muscle just takes over unopposed and yanks the ball, the humeral head, straight up until it literally crashes into the roof of the shoulder. This grinding abnormal contact is what causes the awful, painful arthritis that can make lifting a simple cup of coffee impossible.
This upward shifting is so powerful that it actually forces the bones to change shape. The roof gets worn down into this new, weirdly concave socket. They call that acetabularization. And at the same time, the top of the arm bone grinds down and gets all rounded off, a change called femoralization because it starts to look like the top of your thigh bone. The joint is literally reshaping itself into a new, totally dysfunctional form.
So before you can even think about fixing a problem this complicated, you have to know exactly how bad the damage is. And that's where classification systems come in. They let surgeons grade the severity and figure out the right way to attack the problem.
One way to classify the damage is to look at the basic mechanics. You ask a simple question. Is the joint still basically centered, or has it gone off kilter? A type 1 is still kind of stable, but in a type 2, that ball has started to escape upwards, and that all-important stability is just gone.
Then there's this other system, which is basically a timeline of the destruction that you can see on X-rays. It starts off with just some narrowing of the space between the bones. Then it moves on to that acetabularization, the wearing of the roof. And it goes all the way to grade 5, total collapse of the joint. This timeline really helped doctors pinpoint exactly how far the disease has gone.
Okay, so now we understand the problem and we know how it's diagnosed. So what in the world can be done about it? Well, the treatment really depends entirely on what stage the disease is in.
It pretty much follows this path. You always start with conservative stuff, right? Physical therapy, strengthening the muscles around the joint. If that doesn't work, for the less severe cases, there are some surgeries that can spare the joint. But for the advanced disease, the only really definitive treatment is arthropsioplasty, or a total joint replacement.
In some cases, surgeons can use these really clever techniques like this one, a superior capsular reconstruction. Here, they use a tissue graft to create a new little roof to stop the humeral head from migrating up. It's a way to try and restore some stability without replacing the whole joint, but it's really only an option for specific patients.
But here's the thing. For patients with severe bone loss and arthritis, we're talking those later Hamada grades, these joint-sparing options just aren't going to cut it. The system is too fundamentally broken, and a conventional shoulder replacement wouldn't work either because it still needs a healthy rotator cuff to function, so a truly radical solution was needed.
And this is where our story takes its most exciting turn. Faced with a biomechanical problem that seemed completely unsolvable, surgeons came up with a revolutionary idea that just changed the entire game: the reverse total shoulder arthroplasty.
Okay, the genius of this is just incredible. A normal shoulder has the ball on the arm bone and the socket on the shoulder blade. A reverse total shoulder arthroplasty, or RTSA, does exactly what it sounds like. It flips the script. It puts the ball on the shoulder blade and the socket on the arm bone. This move completely re-engineers the joint's mechanics. It creates a stable, fixed pivot point that allows the powerful deltoid muscle, which is almost always still healthy, to lift the arm all by itself, completely bypassing the need for a rotator cuff.
This quote from the source material just sums it up perfectly. The design empowers elevation of the shoulder without relying on the rotator cuff. It's a mechanical workaround for a biological failure, and it was an absolute game changer for patients who had no other options left.
And I mean, the results, they really speak for themselves. The early versions of this procedure, they had pretty high complication rates, around 24%. But as the implants got better and the techniques improved over the decades, that rate has plummeted to under 10%. What used to be a high-risk, last-ditch effort has become a safe, reliable, and incredibly effective procedure.
So the key takeaway is this: the reverse total shoulder arthroplasty has now become the undisputed surgical standard of care for advanced rotator cuff arthropathy. It reliably gets rid of the pain and gives function back to patients who were once told that nothing could be done for them.
You know, this whole story is just such a powerful example of innovative thinking. Faced with a system that had completely failed, medicine didn't just try to patch it up, it re-engineered the whole thing by literally turning it on its head. It really makes you wonder, doesn't it? What other unsolvable problems are out there just waiting for a solution that's just as brilliantly reversed?